Your elderly neighbor knocks on your door one afternoon. Her face looks pale, almost grayish. She tells you she's burning with fever but can't stop shivering. You hand her some aspirin, suggest she rest, tell her to check in later. She walks back home slowly. 5 hours pass. An ambulance pulls up to her house with sirens blaring. Paramedics rush inside. Later, you learn she collapsed, unconscious. The emergency room team tells her family she has sepsis. They explain that if she had arrived just 3 hours earlier, her survival chances would have been dramatically higher. This scenario unfolds thousands of times every week across the country. At this exact moment, someone is lying in their bedroom dismissing warning signals their body is screaming. Right now, someone's organs are starting to fail while they convince themselves it's just a bad cold. The Centers for Disease Control reports that sepsis kills at least 350,000 Americans annually. That's more deaths than breast cancer, prostate cancer, and AIDS combined. Yet most people can't name a single sepsis symptom. If you find this information valuable, do me a favor right now. Hit that like button. Drop a comment telling me where you're watching from. And subscribe so you never miss critical health information that could save your life or someone you care about. Here's what research shows. When sepsis gets caught within the first hours and treatment starts immediately, survival rates jump dramatically. Medical studies prove that every hour of delay in starting antibiotics increases death risk. The difference between recognizing sepsis at hour 1 versus hour 6 literally determines whether someone survives. But there's a deadly problem. Early sepsis symptoms look exactly like common illnesses seniors experience regularly. A fever that seems like seasonal flu, confusion that appears to be dementia worsening, rapid breathing that looks like anxiety. Before we continue, understand this clearly. This is educational information only. Sepsis is a medical emergency requiring immediate hospital care. If you or anyone you know shows sepsis signs, call 911 immediately. Do not wait to see if symptoms improve. Every single minute counts. Most people think sepsis is the same as infection. That's the first deadly misunderstanding. Sepsis is not an infection. Sepsis is what happens when your body's immune response to infection goes catastrophically wrong. When bacteria, viruses, or fungi invade your body, your immune system launches a defensive response. This is normal and necessary. Your immune system releases chemicals into your bloodstream to fight invaders. These chemicals trigger inflammation at the infection site. But with sepsis, something goes terribly wrong. Your immune system overreacts dangerously. Instead of targeting just the infection site, the inflammatory response spreads throughout your entire body like wildfire. The chemicals meant to fight infection start damaging your own tissues and organs. Your blood vessels begin leaking fluid into surrounding tissues. Blood pressure drops because there's not enough fluid in your vessels. Organs don't receive adequate oxygen and nutrients. If not stopped quickly, this cascade progresses to septic shock where organs begin failing. The kidneys stop filtering waste. The liver stops processing toxins. The lungs fill with fluid. The heart muscle struggles to pump. The CDC reports that sepsis affects at least 1.7 million adults in the United States every year. Of those patients, at least 350,000 die. That means sepsis contributes to 1 in every 3 hospital deaths. And sepsis moves with terrifying speed. You might feel relatively normal in the morning and be fighting for your life by evening. With sepsis, you have hours. The window for effective treatment is measured in hours, not days. Certain people face dramatically higher risk. If you're over 65, you're in the highest risk category. Adults 65 and older have a sepsis death rate of 330.9 deaths per 100,000 people. Your immune system naturally weakens as you age. White blood cells become less effective. They respond more slowly to bacterial threats. This means infections that a younger person's immune system would quickly eliminate can spiral out of control in older adults. If you have diabetes, this concerns you directly. Diabetes impairs your body's ability to fight infections. High blood sugar creates an environment where bacteria thrive. It impairs white blood cell function. Diabetics experience poor circulation, meaning immune cells can't reach infection sites quickly. A simple urinary tract infection can progress silently until sepsis develops. A small cut on your foot that you don't feel can become infected and bacteria can enter your bloodstream. If you've recently had surgery, you're at elevated risk. If you have a weakened immune system from chemotherapy, HIV, organ transplant medications, or chronic steroid use, your body cannot defend itself normally. If you have chronic diseases affecting major organs, particularly kidney disease, liver disease, or chronic lung diseases, your organs are already under stress. Sepsis pushes these struggling organs past their breaking point. Men face higher death rates from sepsis than women. Warning sign number 5. Extreme temperature changes that swing unpredictably. Most people with sepsis develop a high fever over 101 degrees Fahrenheit. This fever often comes on rapidly. You check your temperature and it's normal. 2 hours later, you're burning up at 103. The fever typically doesn't respond well to over-the-counter fever reducers. But here's what catches people completely off guard. Some people developing sepsis don't get fevers at all. Instead, their body temperature drops dangerously. They develop hypothermia with core temperature falling below 96.8 degrees Fahrenheit. This hypothermic response is particularly common in elderly patients, very young children, and people with weakened immune systems. Research shows that hypothermia in sepsis actually indicates more severe disease and predicts worse outcomes than fever does. If someone feels freezing cold, can't warm up no matter how many blankets they pile on, and is shivering uncontrollably, don't dismiss it because there's no fever. Check their actual temperature with a thermometer. If it's below 97 degrees and they have other symptoms, this could be sepsis. Pay attention to how the person looks. Someone with simple flu typically looks sick but not critically ill. Someone with sepsis often looks profoundly unwell in a way that's frightening to witness. Their skin might look mottled or grayish. They might be drenched in sweat or feel clammy. Warning sign number 4. Racing heart and rapid breathing even at rest. With sepsis, your heart starts racing, beating faster than 90 beats per minute, even when you're sitting completely still or lying down. You can feel your heart pounding in your chest. This rapid heart rate persists. It doesn't slow down when you rest. Simultaneously, your breathing rate increases dramatically. You're taking more than 20 breaths per minute. Normal breathing at rest is about 12 to 16 breaths per minute. You feel like you just climbed stairs, but you haven't moved. Sepsis causes blood vessels throughout your body to dilate and leak fluid. This reduces the volume of fluid circulating in your vessels, making blood pressure drop. Your heart responds by beating faster, trying to circulate the reduced blood volume more quickly. Simultaneously, sepsis causes inflammation in your lungs. Tiny air sacs fill with fluid, making oxygen exchange less efficient. Your body detects this reduced oxygen level and increases breathing rate. Your heart and lungs are working overtime, desperately trying to keep your organs supplied with oxygen. You can assess severity by counting breaths per minute. Watch their chest rise and fall, counting each complete breath cycle for a full 60 seconds. If they're taking more than 22 breaths per minute at rest, and this is unusual for them, this warrants medical evaluation. Check their pulse by placing 2 fingers on the inside of their wrist below the thumb. Count heartbeats for 60 seconds. If pulse is above 90 and they're not exerting themselves, combined with rapid breathing, don't dismiss this as anxiety. If you're still watching, take a moment to like this video and share it with someone who needs this information. Drop a comment below telling me which warning sign surprised you most. Your engagement helps this life-saving content reach more people. Warning sign number 3, sudden confusion that looks exactly like dementia. This is the warning sign families miss most often. Sudden confusion represents one of the most common presenting symptoms of sepsis in older adults. Yet families and even healthcare providers attribute it to age-related dementia, rather than recognizing it as a medical emergency. Someone who was mentally clear and conversing normally just hours ago suddenly can't tell you what day it is. They don't know where they are. They might not recognize family members they see every day. They say things that don't make sense. They might see things that aren't there. They might become agitated, trying to get out of bed for no clear reason. Or they might become abnormally sleepy, barely responding when you talk to them. Research found that altered mental status is present in up to 60% of elderly patients with sepsis when they seek medical care. Why does sepsis cause confusion? Sepsis reduces blood flow to the brain. When blood pressure drops and blood vessels dilate, less blood reaches brain tissue. Brain cells require constant oxygen and glucose delivery. When blood flow decreases, brain cells can't function properly. Additionally, the inflammatory chemicals released during sepsis can cross the blood-brain barrier and directly affect brain function. Here's the critical distinction that could save someone you love. Dementia develops slowly over time. If someone was functioning normally yesterday and suddenly today they're profoundly confused, that's not dementia progressing. That's an acute medical problem, possibly sepsis. Think about the timeline. Did this confusion develop over hours to days? Or has it been progressing gradually over months? Acute onset confusion demands immediate medical evaluation. Sudden confusion is never normal. Sudden confusion is never just dementia. Sudden confusion demands immediate medical evaluation. Warning sign number 2, severe pain or overwhelming feeling that something is terribly wrong. Pain with sepsis differs fundamentally from ordinary illness in its severity. People developing sepsis consistently describe feeling worse than they've ever felt in their entire lives. This isn't, "I feel sick" or "I have a bad flu." This is, "Something is profoundly wrong with my body, and I feel like I'm dying." The pain might be localized to a specific area. If the sepsis originated from a urinary tract infection, you might have severe abdominal or back pain. If it started from pneumonia, you might have intense chest pain. But often the pain is more diffuse and difficult to pinpoint. You might feel overwhelming discomfort throughout your entire body. Every muscle aches intensely. Your joints hurt. You feel a deep bone-level pain that isn't relieved by position changes or pain medications you normally take. What makes pain particularly significant is its association with other symptoms and its severity. Someone with regular flu feels lousy, but usually can be distracted, can watch television or talk. Someone with sepsis often can't focus on anything except how terrible they feel. They might curl up in bed moaning. They look visibly distressed in a way that's frightening to witness. Additionally, people with sepsis often describe a feeling of impending doom. This is an actual medical term used to describe the sensation that something catastrophic is happening to your body. You can't explain exactly what's wrong, but every instinct tells you that you're in serious danger. This feeling appears to result from your body detecting that major systems are failing. This instinct should never be dismissed. If someone says, "I feel like I'm dying," something is really wrong, or "I've never felt this bad before," believe them. Don't convince them or yourself that it's probably nothing. Healthcare providers take seriously when patients describe feeling like something is terribly wrong, because that statement so often indicates serious pathology. Warning sign number 1, Skin changes that indicate blood flow is failing. Skin changes with sepsis provide visible evidence that your cardiovascular system is failing, and tissues aren't receiving adequate oxygen. You might see red or purple spots appearing on your skin. These spots don't fade or blanch when you press on them. Press your finger firmly against the spot for a few seconds, then release. If the spot remains the same dark red or purple color without lightening, this indicates bleeding under the skin. Your skin might feel cold and clammy despite fever. You're sweating profusely, drenching your clothes and sheets, but your skin feels cold to touch rather than hot. This happens because blood vessels in your skin constrict, reducing blood flow to your skin to preserve blood flow to vital organs. Your body sacrifices your skin to try to save your heart, lungs, brain, and kidneys. Your skin might look mottled with blotchy patches alternating between pale and dark areas. This mottling, particularly noticeable on arms and legs, indicates severely impaired blood flow. In severe cases, fingers and toes might turn blue, purple, or even black. This represents tissue death from complete lack of oxygen. What makes skin changes particularly valuable as warning signs is their visibility. You can see them with your eyes. You don't need medical equipment or special training. Just look at the person's skin. If you see red or purple spots that don't blanch, if you see mottling, if you see blue or black discoloration of fingers or toes combined with any other symptoms, this is a medical emergency. The critical message about all 5 warning signs is this: isolated symptoms might represent many things, but when you see combinations of these symptoms appearing together, particularly with acute onset over hours rather than gradual development over days, sepsis must be considered. Don't talk yourself out of seeking medical care. Don't convince yourself you're probably overreacting. With sepsis, overreacting means getting evaluated and potentially treated early, which saves lives. The most dangerous symptom indicating sepsis has progressed to its most dangerous stage is septic shock. The symptom is sudden, severe drop in blood pressure. With septic shock, blood pressure drops so dangerously low that organs aren't receiving adequate blood flow. You might feel extremely dizzy or lightheaded. You feel like you're going to faint. You might actually lose consciousness, collapsing without warning. Research found that once sepsis progresses to septic shock, mortality rates jump to 30 to 40%, even with optimal treatment. Compare this to early sepsis, where mortality rates are closer to 10 to 15% with prompt treatment. If you or someone near you shows signs of possible sepsis and suddenly becomes extremely dizzy, weak, or loses consciousness, call 911 immediately. Do not attempt to drive. Do not wait to see if symptoms improve. Studies show that each hour of delay before starting treatment increases mortality risk. Now that you know the warning signs, here's a specific action plan. First, do not wait it out. Sepsis does not improve on its own. It only progresses and worsens. If you have signs of infection like fever, chills, or a known infection site, plus any combination of the warning signs, particularly confusion, rapid breathing, or skin changes, take action immediately. If symptoms are concerning but not immediately life-threatening, call your medical provider right away. Explain the symptoms clearly and use the specific word sepsis. Say, "I'm worried this might be sepsis." Medical professionals are trained to respond urgently when they hear that word. If symptoms are severe, particularly confusion, severe difficulty breathing, chest pain, inability to stand without feeling faint, or loss of consciousness, go straight to the emergency room or call 911. When you arrive at the hospital, tell the triage nurse immediately, "I'm concerned about sepsis." Hospitals have specific protocols that activate immediately when sepsis is suspected. If sepsis is confirmed or even strongly suspected, treatment begins immediately. Treatment includes broad-spectrum antibiotics given intravenously, intravenous fluids given rapidly, oxygen supplementation, medications to support blood pressure if needed, and treatment of the underlying infection source. The key to survival is speed. While recognizing sepsis symptoms is critical, prevention is even better. Prevent infections aggressively. Wash your hands thoroughly and frequently with soap. Get recommended vaccinations. Keep cuts and wounds clean and properly covered. If you have diabetes, maintaining good blood sugar control is essential. Treat infections promptly and completely. Don't let infections linger untreated. If antibiotics are prescribed, take them exactly as directed. Know your body and trust your instincts. You know what normal feels like for you. If something feels different or wrong, pay attention. Don't dismiss symptoms as just getting older. Trust your instincts when you feel something is seriously wrong. If this information helped you understand sepsis and gave you tools to recognize it early, I need you to do something right now. First, like this video by clicking the thumbs up button. Second, subscribe to this channel and turn on notifications. Third, share this video. Send it to your parents, your spouse, your siblings, your adult children. Fourth, drop a comment below. Tell me if you're going to remember these warning signs. Tell me if you're sending this to someone who needs to see it. Your engagement helps more people see this life-saving information. Thank you for being here. Thank you for caring enough about your health and your family's safety to watch this. Take care of yourself. Pay attention to your body's warning signs. Trust your instincts when something feels wrong. And remember, when it comes to sepsis, every hour matters. Don't wait. Act immediately. Your life or the life of someone you love may depend on it.